How many of you know someone in your life that deals with a respiratory disorder or experiences one of their own? Now think about the people who play an important role in managing respiratory disorders. Respiratory disorders is one of the top chronic illnesses, and respiratory therapists have a major role in managing and treating people with respiratory disorders. With how prevalent respiratory disorders are in our lives, aren't you interested in learning how the role of a respiratory therapist is so important? I work in an ICU at the hospital in my town, so I'm surrounded by tons of respiratory disorders and tons of traumas that lead to respiratory distress. Respiratory therapists are the first people we go to whenever we need help in managing someone with a respiratory disorder or in respiratory distress. I have witnessed the many ways that they have made the lives of patients better, and they've made the lives of caregivers easier. Respiratory therapists are vital to respiratory disorders. Today, I will be discussing how respiratory therapy is important in the healthcare world. Today, to begin, I will explain what settings respiratory therapists can work in. Next, I will explain a couple of different respiratory disorders. Finally, I will explain the many roles that respiratory therapists play and work in. Now that you're informed on the overview, let's begin with what settings respiratory therapists work in. Respiratory therapists can work in many different settings throughout the healthcare system. According to a 2018 article published by Rickards, Tracy, respiratory therapy has a prevalent role in many different aspects of the healthcare system. Respiratory therapy is mostly found in hospitals, especially in ICUs and NICUs. Although they can be found throughout the hospital in different units, it is most prevalent in the most critical care units. In recent years, respiratory therapy has expanded into different settings due to the scope of practice that respiratory therapists can practice in. Next, I will be moving on to explain a couple different respiratory disorders that therapists can manage. Let's backtrack. Go back. These were actually the workplace settings that respiratory therapists can work in. This is a doctor's office where respiratory therapists can work in. They can help to manage like low-level O2 oxygen, and they can help to educate in that office. They also can work in rehab centers, and of course, they can work in the ICU. Next, I will be moving on to explain a couple different respiratory disorders that therapists can manage. Respiratory disorders are illnesses that affect the respiratory system, and respiratory therapists can help manage them. Cystic fibrosis is one of the disorders that respiratory therapists see a lot of. According to the editorial team on cysticfibrosis.com, respiratory therapists help with managing airways, clearing the lungs, and giving medications. Cystic fibrosis leads to thick mucus filling the lungs, which can lead to a blocked airway. This right here is an example of cystic fibrosis and what happens to the lungs. Cystic fibrosis is the bottom lungs, and it's caused by thickened mucus all throughout the tract and in the lungs. On the top is an example of healthy lungs. Respiratory therapists also deal with asthma, which is one of the most common respiratory disorders. According to Tricia Smith's article, last updated in 2023, respiratory therapists manage many different aspects of a patient with asthma. They help to give breathing treatments, diagnose patients with asthma, and give medications. This is an example of what asthma looks like in a patient with asthma. This is a normal lining of the lungs, whereas this is the lining of the lungs retracting or constricting, and it makes it harder to breathe, and it can cause excess mucus. Slide. And then this is inhalers that people with cystic fibrosis and asthma can use in helping to manage their symptoms with both disorders. Finally, let's look at the many different roles that respiratory therapists can work in that can help these disorders and more. Respiratory therapists have a wide scope of practice with patients who deal with respiratory disorders. According to Simone Flynn's article published in 2023, respiratory therapists are responsible for treating patients with respiratory disorders of lung ailments. Respiratory therapists perform procedures and tasks such as breathing treatments, managing ventilators, and other breathing equipment, and testing lungs. Patients who receive respiratory care have a better overall experience with managing their disorder. Respiratory therapists can also educate patients and family members. They can help educate patients and family members on what the disorder is and how it will affect their life. They can also educate patients and family members on how to do breathing treatments, give and receive medications, and other ways to best manage their disorder on their own, because a respiratory therapist or any caregiver is not always going to be around, so the patient has to know how to deal with it on their own. Next. Respiratory therapists can choose to specialize in a certain area of the healthcare field with their license. They can specialize in critical care, which would mean working in an ICU setting to manage patients on ventilators and other higher need oxygen requirements. This is an example of a ventilator. There are many different types of ventilators, but this is one of the most commonly used ones throughout hospitals. And then this is an example of a heated high flow machine, which is also used in critical care and intermediate care units. Other oxygen requirements would just be regular nasal cannula with low flow oxygen. Thanks. They can also help with breathing treatments with patients with disorders, or if a patient has gone through a trauma which caused any lung ailments. This is an incentive spirometer, which is one of the most used breathing treatments all throughout the hospital and out of the hospital. You use it to just blow into it, and it shows how much lung capacity your lung has, and it goes all the way up to 4,000, which your lungs can get to, and you hope that it can get to by the time you're done with breathing treatments. And this is an Aerobica, which is highly used in people with cystic fibrosis because it helps vibrate the airway and the lungs, so it gets rid of all the mucus and it's easier to clear. With everything we have discussed tonight, we can gather that respiratory therapists are important in healthcare. I've explained what setting they work in, I've explained a couple different disorders that respiratory therapists manage, and I've explained the many roles of a respiratory therapist. To summarize, I think it's important to note that respiratory disorders can be managed with the help of respiratory therapists in and out of the hospital. Thank you.